My name is Dr. Julian Gallegos, Assistant Professor, Purdue University School of Nursing. So Men's Health Month is actually a month dedicated to celebrating and advocating for men's health across the country. Many efforts are made to bring spotlight to men's health across the country. Different organizations from Movember, the American Association for Men in Nursing, Men's Health Network, they all support efforts related to men's health during this month. Oftentimes there are proclamations that are made by governors across the country, one of which Indiana actually received a proclamation, which basically tells the state that Men's Health Month is a month that is special because there are unique needs that men have, and it celebrates men and their unique healthcare needs. So focusing and advocating for men's health is important because men have unique healthcare needs compared to the general population. Oftentimes individuals fail to understand that men have their own unique needs. We know that men oftentimes will die at a younger age compared to their female counterparts. For the longest time, prior to 1960, men were living longer than women. However, with the efforts specifically for women's health, women now outlive men. So the leading health issues across the United States are still number one, cardiac. So cardiovascular health is very important. The second leading cause of death in men is actually cancer. And then you have other things that factor into men's health, such as their risk due to their occupations, because oftentimes men are in occupations that have high rates of risk. And so therefore, occupational risk plays a huge role in addressing men's health. So stigma for men's health, a lot of it is associated with men choosing not to see providers in a timely fashion. That's usually due to factors such as stoicism, oftentimes we call it the macho culture or machismo. Men oftentimes choose not to see providers because of stigma associated with them appearing to be vulnerable. And therefore, clinicians and family members need to be aware that oftentimes men will not seek healthcare due to many other factors, but these are common factors amongst men. So what can people do to support men's health? I think it comes primarily through advocacy. There's different ways of looking at this at the micro level, obviously. The family unit level, however family is defined, I think partners and spouses and children who have men in their lives should be supporting men and encourage them to seek healthcare when appropriate. Let them understand that it is not something that is bad, that actually it's a good thing to at least see your provider once a year. One of the biggest things is having individuals who understand the unique needs of men as they come into the clinics, hospitals to get care, that these individuals are actually trained in men's health and how men communicate to better serve the men that are actually coming in as potential patients. At the macro level, health policy advocacy is very important. This is because there's a lot of things that can be done at the policy level. Currently, the Men's Health Congressional Caucus, the American Urological Association, and the Men's Health Network are working together to get a policy passed or legislation passed to actually get a National Office of Men's Health started. This would be in parallel to the National Office of Women's Health. This would open up a lot of opportunities for individuals, not only clinicians and researchers, to focus efforts in working towards research, policy, clinical work related to men's health overall for the nation, thus offering opportunities and hopefully improving the health care of men for decades to come.